As we celebrate 25 years of proton therapy at Loma Linda, we also look toward the future. Advances in medicine have led to breakthroughs in other forms of radiation therapy, in surgical procedures, biotechnology, and pharmaceuticals. And so proton therapy must continue to evolve as well. The advances in proton therapy at Loma Linda have served as the platform for future developments. The future of proton includes developments that allow proton therapy to be used in other forms of cancer and diseases.
So things that are still coming, there are patients, breast cancer patients, who need to have more extensive radiation to include the lymph node areas. Those are patients with more advanced stage disease, and we believe that proton therapy will be usable in those patients as well. That will likely require a scanning beam to do that.
The difference between a scanning beam and a scattered beam, those are the two terms that are used most often. A scattered beam is a group of protons that come out of the machine. They're at about 1.5 to 2 centimeters in size. We have them hit a metal foil that spreads them out into about a 15 to 18 centimeter field. And all of that big field then goes towards the patient. Then you do things to kind of shape it a little bit. Even though it does a great job of shaping the sides and the far end of where proton's going, it does not do a good job of shaping the proximal side. So you don't get the ultimate shaping or conformality that you would like to have. What a scanning beam does differently is if you have an accelerator, and it produces many different energies of protons, and ours does from 70 million volts to 250 million volts. That affects how deep in the patient it goes. And so you take that, instead of blowing it up, you basically take, the term's been given at a pencil beam, because it's almost like it's a pencil size now. And you basically raster that, like an old television screen would raster back and forth to paint a picture on a TV screen. You do that with the proton beam and actually make a three-dimensional target.
Expanding the use of proton therapy to treat children is critically important. Children tend to be more sensitive to radiation. As with patients of any age, proton therapy's precision leads to fewer side effects. This is especially important for children in order to avoid harmful side effects during their development.
There are some cancers, particularly some of the children's cancers, that require a very large field size that covers a major portion of their body. That's why it's so important to miss as much normal tissue as you can. This can allow us to do it in essentially a relatively short period of time.
One of the things that we've been doing here is treating arteriovenous malformations, which is a collection of blood vessels in the brain. Usually presents itself in children. And what we do is, by treating them with one dose of radiation, we can cause those blood vessels to close on their own, and essentially the AVM, or arteriovenous malformation, goes away without surgery, without invasive procedures on the child.
The treatment of pancreatic cancer can be especially challenging. When diagnosed, pancreatic cancer typically is advanced, making chemotherapy and conventional radiation more difficult to use. This makes proton therapy an attractive alternative treatment.
The pancreas is probably the most stubborn disease you heard from the news of Wall Street Journal or USA Today. The thing is, the pancreas is right sitting in between the guts and the stomach and the kidneys. It's hard to deliver a good radiation dosage to this area without damage those organs. As we all know, proton be able to deliver low dose going in, maximize the break peak, hit a high target, release the energy, and then stop the energy release after that.
Treatment of esophageal cancer and other gastrointestinal cancers with proton therapy have also shown great promise.
Esophagus, the lungs, the heart, say no more. That's the most difficult area. You really don't want to go in there without knowing which collateral organs you're targeting it. You need to minimize the complications so that there would be a continued good surgical candidate that would translate an excellent prognosis and outcome.
Tumors in the liver are very difficult to treat because typically liver tumors arise in livers that have cirrhosis or other disease within the liver. So meaning that to radiate a tumor in the liver, not radiating the normal parts of the liver becomes very important.
Proton therapy may also have an application for treatment outside of cancer, atrial fibrillation. With atrial fibrillation, The electrical signals that the heart relies on are out of sync, leading to an irregular heartbeat. The challenge in treatment of this disorder is both in the ability to see into the body to the beating heart and deliver a precise dosage of radiation to correct the condition.
With our atrial fibrillation project, in essence, we're treating very small millimeter-sized parts on the heart. So instead of going in with a catheter and cauterizing these locations around the valves of the heart, we're going to shoot it with a beam of radiation, which is about 1 millimeter in size. So if you can think, we've got to not only target this location with a very, very small beam, we've got to do so while the patient's breathing and while their heart's beating. So that's my role, is really on targeting and developing the technology to allow us to target those regions in that specific, around that specific valve, to allow the clinician to do what they want.
Treatment protocols have also been developed for the treatment of pain using proton therapy. Proton therapy is currently being investigated for the treatment of pain for our military veterans.
One of the major problems that the Department of Defense has told us they're having is veterans returning from action. They get these injuries that cause significant pain that are very, very hard to eliminate. So we're looking at research right now where you can focus on where that nerve pain impulse is coming from and hit that with a form of radiation to essentially hopefully neutralize that pain so that it's not interpreted by the brain as a painful area.
We're the only proton center in the world who's working on this, and really by irradiating a small section of the spinal cord, the thought is that we can actually cut down their pain without needing drugs.
The future of proton therapy at Loma Linda is as exciting to consider as the opening of the treatment center 25 years ago. As our legacy continues, we are committed to heal, to discover, and to shape the future of proton therapy, not only at Loma Linda University Health, but across the world.